Hi, everyone. My name is Hamara Osman. I'm the VP of Research and Public Policy at Muscular Dystrophy Canada. I welcome you all to our Let's Talk NMD, Let's Talk Neuromuscular Disorder webinar. Today's topic is on sexuality and neuromuscular disorders, and we timed this just in time for Valentine's Day, but we know that this is a topic that year-round is important to really think about from an occupational therapy perspective and also engage people who are impacted by neuromuscular disorders. We're really pleased that we have Samar and Louis Pierre here today to present on this important topic. Louis Pierre is an occupational therapist who's worked as a clinician for more than 5 years in intensive functional rehabilitation with clients with neurological health conditions, especially individuals with stroke. He completed a master's degree in 2019 and a doctorate in 2023 in rehabilitation sciences at the University de Montreal, where he spent his time creating and disseminating an ongoing education course designed to give occupational therapists the tools they need to integrate issues of sexuality into their clinical practice. Very happy to have you, as well as Summer. Summer holds a master's degree in occupational therapy. She has been practicing in Saguenay, Quebec since 2018. She's a doctoral student with the University of Sherbrooke and a PhD candidate. She aims to better understand the functional impacts of cognitive impairments in people living with myotonic dystrophy type 1. She completed her master's degree in health sciences in August of 2021, and both in her research and clinical practice, she's worked with people with different types of neuromuscular conditions, including OPMD, Charcot-Marie-Tooth diseases, and she is the first author of a practical guideline to support occupational therapists in addressing sexuality with their NMD patients. I'm really pleased to have you both and happy to see in the audience we have a good mix of occupational therapists, I see, as well as people impacted by neuromuscular conditions and their family members. So over to you both.
Okay, great. So, hi everyone. So today, I am Louis Pierre. I am very happy to co-present that presentation with my colleague Samar. And you will see we will co-present today. So sometimes there might be some bumps here and there, but we're gonna make it through the presentation, and we're happy to be with you today. So thank you, Humira, for the very kind invitation and for graciously introducing us. It's a pleasure to be with you today, all, and it's nice to know that there are a variety of different profiles, so people with lived experience and also clinicians in the room. It's great to all have you with us. And hello to the people who might also listen to that presentation a little while after we record it. Okay, let's go ahead. So yes, a note to participants. So feel free to write questions in the chat. Or you also have a section which is called question and answers, Q&A. You can also use this section. And at the end, you will see we will answer all or most questions that we can answer. And you will also have the opportunity to turn your mic on if you want to interact with us, discuss, or just say your question out loud. So, but for us to stay focused, we will take your questions at the end of the presentation, which should last around 30 minutes, I think. Okay, we can go ahead with the next slide. Thank you. So just to give you a little idea of what we're going to talk today. So we're going to start with a little background. So talking about, well, what do we intend or what are we talking about when we say sexuality and sexual health? We're also going to address how can a disability have an impact on sexuality, and we will address some specific impairments that are related to neuromuscular diseases that could affect in certain ways the experience or participation in activities related to sexuality. We're also going to talk about how we could address sexuality with a healthcare professional or with our patient, depending on which stance we are having. And finally, we're going to talk about that updated and newly translated practice guideline that Samar is leading. And finally, we're gonna finish with discussions. So because that is mostly why we're here with you today, to yes, present a little information, but mostly to answer your needs in the best way that we can in our limited time frame. So let's go ahead with the background. So first of all, maybe a little definition. So sexuality has been defined in a lot of ways by different authors, different experts. Uh, a definition that I like to use is the one that was published by the World Health Organization. And you have it here. Well, you have a part of the definition here. So what is sexuality according to the WHO? It's a central aspect of being human throughout life, which encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Sexuality is experienced and expressed in thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. Finally, while sexuality can include all of those dimensions, not all of them are always experienced or expressed among people and also by a same person throughout life, for example. Thank you. We can go ahead and maybe okay, here is okay, this is for sexual health. So in healthcare, what we aim to help patients and people with disabilities get to is a state of optimal sexual health. So what is sexual health actually? Well, in fact, sexual health, it's a state of physical, emotional, mental, and social well-being in relation to sexuality. So it is not merely the absence of disease, dysfunction, or disability. So while what it says here is we can have a good sexual health while still having a health condition or disability. And it's not because we do not have a health condition or a disability that we necessarily have a good sexual health. So it's more complex than that, and there is more freedom or there is more uh, yeah, it is more complex than that. It is what we could say with my level of English. So sexual health. Oh, sorry, Samar. I'm just gonna pass through very quickly. Just a second. You have the rest of the definition here. It can be a little dense, a little hard to read, but here when we talk about sexual health in the second sentence, sexual health, we're intending a positive and respectful approach to sexuality and sexual relationships, as well as the possibility. What is sexual health also? It's the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. And finally, for our sexual health to be attained or maintained, our sexual rights have to be respected, protected, and fulfilled. So sexual rights are closely related to human rights. And if you want to read a little more about it, you have the reference at the bottom of the page. Thank you, Sama. Um, so uh, I am not sure with the webinar format if we can really ask you to answer this question, but at least I would like you to take some time to just reflect on your side. If you have, let's say, if you have some paper with you, you can take the time to note. You can write it on a Word document. Um, I would like to ask you, in your own understanding and in your own experience, and with your own definition of sexuality, because we can all have different definitions of what is sexuality and they can all be valid. How can sexuality and intimacy be experienced in a person's daily life? So, how can sexuality and intimacy be experienced in a person's life? Let's go ahead with the slide. Maybe you will not have had the time to write everything, but at least we're going to get going. So here are a couple images of how sexuality can be experienced throughout life in our daily activities. We can experience sexuality with the way we take care of ourselves, with the products that we use to wash to feel good about ourselves, maybe to how we comb our hair, how we put on makeup, the type of clothes that we choose to wear in a day. Um, It can also be with the emotions or the reactions that we want to show or that we want to keep to ourselves, with the activities that we want to do. It can be in the leisures that you do also, where you might experience your sexuality. For example, if you like to attend certain shows or to do certain sports with certain persons that with whom you can express your sexuality or the person you are, those can all be ways where sexuality can be experienced. And of course, sexuality can also be experienced through sexual activities, which are very varied and can be very complex. And as long as they're pleasurable and that they're meeting every person's rights, well, there is no wrong sexual activity. So, and also one thing that I didn't say, it can also be experienced through our relationships and the conversations we're having with others. So yeah, it leads us to our next slide here, that sexuality can be experienced with ourselves and others. So obviously here we're talking, for example, about sexual orientation, but also that sexuality must not be considered only as a thing that happens between two or numerous people, but we can also have a sexuality with ourselves and intimacy with ourselves, and it is legitimate, and it is something that is important also in the development and the actualization of our sexuality as human beings. Okay. So now that we've set the table on our background regarding what is sexuality, and again, you might, just an aparté, you might also have different definitions or different things that you include in your own way of seeing sexuality that I did not name so far, I did not say, but it doesn't mean that it's not relevant. We all have our definitions of sexuality, and it's okay. Um, Let's start with how can a disability impact sexuality and, for example, neuromuscular diseases. We can talk about impacts that are directly on sexual function. So what is sexual function? It is the way that our body reacts to a sexual stimulation to, for example, participate in a sexual activity or either sexual activity and or reproduction, for example. So on sexual function, what we can see is a desire disorder, erectile dysfunction, vaginal lubrication disorders also. So these are very related to, especially the 2 and 3rd one, very related to genitalia. And it's not the only part that is related to sexuality. It's more complex than that, but still for some people, it can be important for them. So about sexual response. We can also see a decrease or even an absence of orgasms, a decrease in sexual satisfaction with in relation to sexual activities. And we can also see, for example, a decrease in the variety and the frequency of sexual activities that people with disabilities can participate into. So, and the proportions of how much it can happen in persons with neuromuscular diseases, we don't have a direct or very precise data because it can vary for each person, but also among the different types of neuromuscular diseases. So that would be it for this slide. I think I'm going to hand it out to you, Samar.
Yes, of course. So thank you, Louis-Pierre, my favorite experts on sexuality and occupational therapy. So thank you very much. These were the primary impacts. So directly related to the sexual function, and it's not specific to neuromuscular disorders. So now we're going to go a little bit more personalized. Oops, I just want to make sure I see you guys. Oh, okay, I just see Louis-Pierre, but at least it's one face. Okay, so now more related to neuromuscular diseases. As you might already know, neuromuscular diseases encompass a lot of different diseases. So I can't talk about all of them in one presentation, but here are the most frequent symptoms or impairments we can see usually related to nervous system and muscular system. So I'm going to describe, so we have a higher or less sensitivity. There is fatigue, apathy, which is a difficulty initiating new activities, hypersomnolence. So these are more specific to myotonic dystrophy, but they can happen in many other diseases, and cognitive impairments. And for muscular systems, we have a decrease of muscle strength, endurance, there is pain that can be associated with some neuromuscular diseases, and myotonia, which is a difficulty relaxing after a muscular contraction. So all of these words, just to say that, second, these impairments, they can lead to what we call secondary impacts. So secondary impacts are the abilities, when your ability that are needed to perform your sexual activities are impaired or limited. So, of course, cognitive impairments can happen in neuromuscular diseases, such as difficulty to focus, remember important things, do multiple tasks. There is also difficulty initiating activities that can be related to apathy. And I like to point that out at every presentation I give. Apathy does not mean you lose interest in your activity. It doesn't mean it's not important to you anymore. It's just a difficulty to start the activity. And this is something that a lot of patients with myotonic dystrophy experience, and they feel lonely in that, and they feel like it's only happening to them, but it's a normal symptom. So I'm talking, I like to mention it every time. And also what we can see or imagine more easily is the secondary impacts of muscular problems, such as difficulty. Of course, when you have less muscle strength, if you have less endurance, well, some sexual positions will be harder to assume and to maintain. When you have fine dexterity in problems, like of course it can influence your ability to button your shirt, but also to do masturbation or even use sexual toys for masturbation. So these are very important also. And pain, of course, I don't have to mention, but pain can limit sexuality, and the fear of having pain can just restrict you or stop you from having sexuality, which is not what we want. So because of all of these, we could say barriers or limitations, there is, oh, I forgot some. I added some, because more than muscular and nervous system, depending on the neuromuscular diseases, all of these symptoms can influence in different ways your sexuality. And when I say in sexuality, just as Louis-Pierre mentioned, it's more than the sexual act. It's dating, it's having an intimate relationship with your partner. So all of these can influence, and we do, what is nice about the guideline, and I'm going to present it to you later on, is that we divided the guidelines, some specific suggestions, we divided it into by impairments, so we can find some solution for some specific impairments. And I forgot what I was going to say, but I'll continue on this and I'll come back later. So it's important to talk about tertiary impacts. So more related to the psychosocial consequences of having a neuromuscular diseases. More frequent, what I see more frequently in my practice is the changes in the body image because of the muscle atrophy. Your body does not look the same as before, and this can influence self-esteem. This can influence many, many things in your sexuality. So these are all things, not necessarily the occupational therapist, but these are all things that rehabilitation or a healthcare professional can address with you. And not one is more important than the other. It's the important thing is what's important to you. So I'm gonna try to remember these, but okay, I really forgot what I wanted to say earlier, but I'll continue, and if it comes back, I'll tell you. So when addressing sexuality, I always ask people, but we can't really necessarily discuss today, but who do you think should address it first? So this is nice today because we have, as Omira said, we have healthcare professionals, but we also have patients and families. So the answers may vary, but what we know, according to research and also our own experience, me and Pierre, we know that patients, they prefer that healthcare professionals address the subject first. So we dedicated a big part of the practice guideline into how to address sexuality for the first time, because it's not an easy task. It is not easy for the healthcare professional, not easy for the patient. So you want to do it with respect. We want to do it at the right time. And so in the guideline, we provide some more detailed suggestions to address sexuality. We have a graphic designer that made one of the page 18 in the guideline. I think it's fantastic. It's really visual. And I just wanted to, when you're gonna start talking about sexuality with your patients, you're gonna find that some sentences are easier. You prefer some sentences just because of who you are and how you address some things during your daily practice. My favorite one, but it's specific to me, I really like the one on the post-it. So I usually say to my patients, many people with, for example, myotonic dystrophy have questions about the effect of the disease on their sexuality. I don't even see the second part, but it's also really good. So what is your experience of this? So you just have to kind of open the door and let the opportunity to your patient to either answer or close that door. And it's okay if they close that door and they don't want to talk about it. At least they know you did your part, which is letting them know that sexuality is important and that you can address it as an occupational therapist or other healthcare professional. And sometimes, and it happens a lot, they say no at first, but then they continue thinking about it. And then when they are ready, then and they are sure that they can have trust in you, then they address their issues, and then you are ready to talk about it. So hope I'm not going too fast. What do you think, Louis-Pierre? No, thank you. Okay.
Yeah,
So
looking very good. Thank you, Soma.
Thanks. So occupational therapy, as you know, or are just about to learn, we are experts of activities. So we analyze activities and we offer personalized solutions to our clients to overcome barriers or to compensate or to develop skills so that they can participate in their activities that are important to them. So as we do the same as we do with almost the same as when we help people do meal preparation or dressing. Sexuality is an activity that is just as important. So we do teaching skills and we adapt the activity. So in the next few slides, it's just to give you a preview of what is in the guidelines. So we're not going to get into the detail, but just so you know what you can learn by consulting the guideline. So in occupational therapy and also in physical therapy, we do a lot of pain management, which is an important part, especially in neuromuscular diseases. You can have pain, you can have fear of having pain, such as I said earlier. So we can either help develop or reinforce certain functions to make it to make you have less pain, or we can compensate. I do like the example that is on the picture. I always tell it whenever you can do really little changes, simple changes in your sexual activity, and it can lead to really different results in terms of pain. For example, if you are on missionary and you're on top and you press and you hold yourself on the bed with this position, it hurts a lot, the wrist. So if you just make this slight change of putting it in neutral position, you're gonna be able to last physically longer your position and make it really more enjoyable. So different tips like that we can give for pain management. Positioning, we have a table. It goes on 2 pages, so it's not only 3 positions, we have more than that, but to present different positions you can use and what it helps with. For example, if you have muscle weakness, pain, fatigue, also the use of cushions to better position yourself, again, to help with pain management and so you can tolerate the position longer. Of course, we occupational therapists, we do like our technical aids and equipment. So first of all, I always like to just make it known to my client that the equipment that they already have, they can be used for sexuality, such as the bed helper, hand grab rails. These are all things we can use for sexual activities, even electrical beds. Of course, they mainly come in 1 person, but there are double sizes of electrical beds, which can be really easy, not easy, which can make it easier for having sexual activities. And there are also equipments or technical aids that are created for sexuality, just as the intimate rider mate, which I really like, because the intimate rider, it was conceived for people with, how do you say that in English? Blessé médulaire.
Yeah, for people with spinal cord injury.
Thank you very much, Hubert.
Yeah.
So it does the va-et-vient movement, so back and forth. And so it makes it easy. It allows you, in fact, to have sex with this equipment. So these are just a few examples of possibilities that you have for sexuality. We are also good at, us as occupational therapists, at giving energy conservation techniques, such as choosing the right moment, taking breaks before and after, and and this is, of course, the guideline is full of different solutions, but what you have to do is you have to consult it, and then you sit down with your client and find, by discussing with him or her or them, what is the best solution for them. So if exploring alternatives of penetration, such as oral sex, it depends on your client, but it is really something that can be less demanding and makes it more accessible. So different options. And last but not least, masturbation. As I said earlier, the same principle applies. If you have already a universal cuff to use for your razor or your toothbrush, why not use it to help you hold on to your sex toy, your vibrator? We are, as occupational therapists, we are not here to tell you which sex toy to buy, which gives you the most pleasure. That's not our role, but our role is to find you a sex toy that matches your abilities. For example, I do like to recommend the Doxy one or any other like that looks like this, because it has bigger buttons, which is more easy to press, or even all the remote control, like the WeVibe here. So you position your sex toy on yourself, and then you have the remote control. You don't have to like move. It takes a step off what you have to do to have to masturbate, so it makes it a lot easier.
It's interesting, Sama. I'm sorry I'm interrupting. So you were talking about the 2 technical aids that we see on the right, right?
Yes,
So the Doxy
absolutely.
one is the purple one that
Yeah.
looks also like a mic, something like that.
Yeah. Yeah.
And the WeVibe is more the one that we see with the cell phone. Is it right?
Yeah.
Okay,
Yeah, the cell
interesting.
phone, and these are, we didn't update the repertoire of sexual toys, but they are, as we speak, they are creating new ones. And so I know that nowadays you can have some sexual. I was helping a colleague yesterday with one of her patients who had that problem, and they are sexual toys that you can put directly in your, I don't have a better term, panties. So you just put it on like when you dress up, and then you use remote control. So that makes it so much more accessible. So new sex toys every day. You just have to look for it. Now I'm going to show you quickly how to access the guidelines. So if you can, you can take your cell phone. It's going to lead you to the website. But if you don't want to go get the presentation every time, I'm going to show you how. Oops. Okay, we're starting from the start. Okay, so you can just tap grim.ca, which is our website, and it's in French, unfortunately. So you go to tools, which is outils, oops, and guide ergotherapy, which means occupational therapy, and sexuality. And then you have the French version here and the English version. So you click just here, it's going to lead you to the website in which supports the guideline. And there you have it. It's downloading. And then you have the guideline. So I really want to precise. I want to tell you again that it's an occupational therapy guideline. So it's not a guideline for patients, but later on, we're going to give you some suggestions of resources for patients and families, or you can just print it or just tell your occupational therapist that there is a guideline if they want to help you. So you can also use it that way. So here's the guideline. And didn't we want to show anything else? Did you want to show some these extraits? No, not necessarily.
Well, you know what? Like, yeah, no, I think you've already talked a little about the
Good.
different sections, and we see it here in the table of contents. Like, so yeah.
Good. Perfect.
It's
So I'm
nice that
gonna,
you showed us how we can access it, and I'm pretty sure that if you Google practice
yeah.
guide, occupational therapy, sexuality, and NMD, pretty sure it's going to lead you quickly also, but yeah, we can try. So you're
Sexual.
trying practice guidelines, sexuality, neuromuscular disease.
This is the uh, physiotherapy one, but still interesting to know. Did you know if you have a physical therapist, we also have a guideline in physical therapy, but you could just tap then occupational therapy here and you're gonna find it. So
Okay, interesting.
That was
we
great. There are a few questions, and some of them were centered around
accessing.
where the guidelines can be found. So I'll let you go ahead and share any resources that you have from a patient perspective or a client perspective, Summer, and then I'll summarize some of the questions that are coming in.
Good, thank you. So these are more resources for patients and families. So people living with neuromuscular diseases. I have a copy of the Ultimate Guide to Sex and Disability. It's written big, so if you have vision problems, it's adapted to that, and it's experiences that people with disability have lived, and it's a really, really good book. Pleasurable, can I let you talk about it, Louis-Pierre?
Yes, yes. So thank you, Samar. So the Pleasurable Manual, it was designed in in 2009. So it's a manual that is describing some general categories of ways you can adapt sexual activities. Mostly, it's describing how you can position differently and which kind of sex toys or sexual devices you could use to facilitate your sexual activities. It was designed for people who have a spinal cord injury. However, I would say that it is applicable for a lot of people, including persons with neuromuscular diseases. And there are a lot of images there, some nice, respectful images. So I encourage you to take a look at it if you're interested.
Yeah, and we have speech. If we have French speakers here, it's coming in French in the future, right? So
Yes,
gonna be
it will,
able
and
for
we will be updating it also this year. So if you want, Humira, maybe when we will make it available, I could write to you. So for us to disseminate the information also for the people attending this conference, this presentation.
We do have the Come As You Are co-op, which gives they have a section on the physical disabilities and the impact on sexuality and examples of sexual aids. I'd really like to say also that if you are someone who has a disability and you want to learn more about sex toys, people in sex stores, I'm sorry, they are really experts at their product. And I've been there and I've asked them about do you have like sex toys with better buttons or for this issue? And they really know their stuff. So you don't hesitate, and I've had positive experiences. No judgment, so I encourage you to go there and see them. Other resources, I didn't know about that, Omira. So I just found out when I was practicing how to get the guideline. I saw Teens, Sex, and Neuromuscular Conditions, a practical guide for clinicians. So it's not for patients, but still, it really, really interesting. Lots of resources also, and already in English. So a really nice guide, but of course it's for teenagers. And but still, it can apply. For my fellow occupational therapists, there is, if you didn't know already, a podcast on occupational therapy and sexuality. So really nice listening to. And we would like to end this presentation by giving up our thanks to all of you can see so many names because it's such a big teamwork, this guideline. And the English one, the French one, so everyone who has collaborated into the content, to writing the guidelines. So thank you very much. And of course, Muscular Dystrophy Canada, who helped us get funding also for the English translation, and you have supported us through all this process. So thank you very much. And I think that's pretty much it. These are our references, and we are ready for your questions.
Wonderful. Thank you both for such a clear presentation, really bringing a topic that's not well described. And so really this is the point of our Let's Talk NMD webinars, bringing forward evidence, conversations, information. So thank you for doing that. Many of the questions, as I mentioned, were access to the guidelines. So I'll follow up with those links. Here's a great question in the chat, in the Q&A. What are your thoughts on intersectionality? So really looking at disability and LGBTQ+. This is a topic that is often ignored. It's often avoided in either community.
Thank you. Samal, do you want me to go ahead or?
Yes.
Yes. So thank you for that person who asked the question and who raised that subject. Intersectionality is a concept that we see more and more in studies on sexuality and disability, and for also for considering other aspects of a person that can influence either positively or negatively their access to health services, but also for opportunities to engage in sexual activities, for example. So yes, it is definitely something that is important. It is a very broad question about what are our thoughts regarding intersectionality, because it could be in itself one presentation, but I would say that this is an aspect that is important to integrate in our reflection when we're either as a clinician or a researcher. When we have a person in front of us, we must not look only at the disability of the person, but the person as a whole, and consider all of the different characteristics and the different sections in intersectionality to offer a better care and a better understanding of how we can help that person and what are the challenges that they may experience, for us to provide better care and better research. That's mostly what I could say, but thank you for bringing that up.
Are the guidelines mainly centered around relationships with the opposite sex, or does it really touch on same-sex relationships as well?
I think we mostly we made it as inclusive as we could, but still it's we could have more examples. I think we could work more on that in the guideline, but I think the images are male and woman. I'm not sure, but this is, yeah, we made it 2016 to 2018. So and we just updated it, but yeah, I think it's mostly male and women. Can you correct me?
Yeah, well, somehow from what I remember, because you're more the specialist of the very specific content of the guideline than I
Yeah,
am, but we've made it as gender neutral as
yeah.
possible because, like in the the figures for the positioning, for example, those are two very neutral persons.
Ah, okay.
It is not associated to gender, and we focus more on sexual activities rather than a certain sexual orientation. So I would
Mhm.
say, of course, there is always room to be more inclusive and everything, but I think that we've made an effort
Yeah.
of not only focusing on heterosexual relationship, and we've
Yes.
even wanted to emphasize that sexuality does not, like we said in the
Oh,
presentation,
yeah.
and it's also in the guideline that sexuality can be experienced with ourselves also, and it's not only a couple thing, for example. But maybe it's something that that person who raised that question, which is a very interesting question, if you have suggestions or
Yeah.
advices for us to improve the guide, it will be more than welcome. And because
Yeah.
there's always room for improvement, and we would be more than happy to do it. What do you think about that, Sama?
Of course, of course. Yeah, I just went to look again, and yes, it's gender neutral. I don't know what I was but
Okay.
yeah, and we do want to make it better if we can. So thanks.
Do occupational therapists typically work with clients in the sense by themselves is a question, like the person impacted by their neuromuscular condition? Or oftentimes is that consultation, are those discussions happening with a partner in the room as well?
For my practice, it's usually with my patient, and I always ask for my patient if I can talk, if this is something that they want to address with their partner and they don't know how to, and they would like me present. Yes, I can of course talk to both of them, and but the main patient, the main person is always my patient, so I cannot, and I would never talk to what my patient said to his or her partner before asking for consent, of course. Um, that's pretty much it. Did you want to add something else, Rupia?
Yeah, well, I'm just not really sure, Humira. So if the question was, are those conversations actually happening or not? Like,
Yeah, is it happening as part of these clinic visits with OTs, and is it typically directed at the client or the patient, or is it also inclusive in that the partner is also welcomed into the conversation to learn about adaptive
Mhm,
movements and
I
processes
get
like
it.
that piece? Yeah.
mhm. So yeah, so Sama, did you want to? Thank you,
Yeah,
Humira.
I
Did you
just
want to
wanted,
add
I
something?
think it depends on the, I would say, of course, the person is always welcome, the partner, but it depends on the occupational therapist, of course. Some are more comfortable than others, but in my opinion, yes, this is something we do teaching and many other activities with the families and relatives. So why not with sexuality would be my question. So.
Mhm,
It was great
mhm,
also to hear that in today's presentation, there was this conversation around bringing it up as occupational therapists and having that conversation. I think this could also extend even into physicians. So some individuals don't have access to OTs depending on funding, supports. So really a lot of these learnings can be transferable. And thank you for bringing up the document that Hall and Bloorview put together. I do see Charisse on the call. She's one of the occupational therapists at Hall and Bloorview Kids Rehabilitation. I will include that as well for all of you. Just another
mhm.
question, which is many people with neuromuscular conditions often have personal care attendants or receive 24/7 care, whether it be formally with a personal care attendant or a family member. Are there any suggestions that our OTs offer in terms of asking for that personal time for exploring sexuality, as was described today? Tips on navigating
Do you want to
time
go,
away
Lucia?
from other persons in
Well,
the
yeah,
home.
I could come. That's a good question, Humira. I just feel that maybe somehow
Good.
you live this in your daily practice, maybe.
Yeah.
But and I could add after if you want.
It again, it depends. I feel bad saying that all the time, but it depends, of course, on the comfort of the caretaker. But as long as we're tracking giving space or giving intimacy and some alone time, that's usually no problem. So we do talk to caretakers and asking them this is important, or we can also help the patient talk about this need themselves. But we did have a lot of occupational therapists asking us, even in my practice, can they help? Can they, for example, position the person, give them the position, the sex toy and things like that? And this is a big question I cannot answer just today. I don't know if that was the question also, if it included that, but it's a topic we do have to think about a lot, ethically, and for the people doing this job. So I wouldn't have an answer now, but it is sure an important thing, an important issue and topic.
Thank you. And if I can add, Humira, to that very interesting question, like intimacy when we have a healthcare provider from any discipline. Like now we talk, like in your question, Humira, you talk about an attendant that is at home, but we can also think about, well, if we are at the hospital or in a rehab center and we need to spend the night there, and like we might be followed there for a couple of weeks, for example. It could happen, I think, also for people with neuromuscular diseases.
Yes.
With healthcare professional barging in the room at any time that we're not sure when we can have intimacy, this can be a real challenge, and it can complicate or make more complex the experience of intimacy with ourselves and the experience of sexual activities. So those are times where there are conversations that are needed regarding, well, I need time, I need my own space. Is there some way that, for example, could you knock at the door before coming into my room? So some very concrete solutions. I would say occupational therapists, like for the other part of your questions, Humira, I think occupational therapists first can help their patients or their people they're helping identify, well, what do you need intimacy for? Because sometimes it's just some private time and we just want to have a 1 hour with ourselves. It's not necessarily related to sexual activities, but like just to have a break, and to know that you can have that space. It can also be related to sexual activity, but sometimes in relation to sexuality, it might be a more charged or sensitive subject for some persons. So occupation, and so maybe patients or people with NMD can have a harder time addressing that with an attendant. So occupational therapists, for example, can set a meeting between the attendant, the person with NMD, and themselves to just have that discussion, the three of them, or look at different ways of having those conversations or delivering the message between each person, the person with NMD and the attendant. But they can also help in enacting a plan and a schedule to help in that. So, but there are no specific guidelines. It's really custom based. It's really tailorable for each situation. But of course, yes, occupational therapists could help. But the essential before that would be that sexuality be addressed, that there were conversations and this is where it is challenging regardless of the situation of disability. We need to do better in opening that door, like Samar was saying earlier, opening the door to sexuality and telling our patients and the people with disabilities that we're helping that it's okay to talk about sexuality with us. So, and after it's in the air, like I think OTs will be way better positioned to provide the help that their patient need, because I think sometimes most people might keep their questions for themselves because they don't know who to ask them, and it can be normal, like so. But we don't want that for people with disabilities. We want to help them. So for example, that's why we're here today. That's to try to make some changes one thing at a time.
Absolutely. Well, thank you, Samar. Thank you, Louis Pierre. I really appreciate you both taking the time to share information, the evidence, the guidelines around sexuality and neuromuscular conditions. I know it's not always an easy or a sensitive topic in general, but these conversations and information sessions like this are so important. They really help us to break down barriers. They help us to address real needs and help to ensure that people living with neuromuscular conditions receive the support they deserve in all aspects of their lives. So thank you for your openness. Thank you for the work you've done towards the guidelines, and of course, for your willingness to engage in today's conversation. Thanks everyone for joining. Have a good rest of your day.